Eva, well, we are back and we're talking about natural hair loss treatments today. And boy, top of the list is saw palmetto. And I know you really like to refer to saw palmetto as a different name because it does block much of the DHT that is obviously a very sexy known acronym around the internet world. So tell us a little bit about what you know and how that our audience can start to slow their hair loss and with a natural treatment like saw palmetto.
Okay, so we have a product called Serenoa. It's the extract of the berries of the saw palmetto plant, and it's a very effective natural DHT blocker. And what that means is that when free testosterone circulates, it can bind to the hair follicle, and in binding, there's a hormonal transaction called 5-alpha reductase, and it's like a handshake, and it changes it from being testosterone to being dihydrotestosterone DHT, and that can miniaturize hair and cause hair loss, predominantly in men, but also in ladies. And what Serenoa does is it blocks both types of DHT. There have been studies done, there has been research, and it shows it's really effective. But where it wins out over the pharmaceuticals is that there are not the same side effects. So when we block DHT with a pharmaceutical like finasteride, you can develop something called Post Finasteride Syndrome. And that's a group of symptoms that can be anything from anxiety to depression, lack of libido, sexual dysfunction, a whole raft of things. And what I find in clinic is people are already anxious and some people are depressed about their hair. So you don't want to be offering them something that can exacerbate that position and make things seem a whole lot worse. And that's where Serenoa really wins out because it is effective.
Oh, yes, 100%. And I'm so glad you brought up the point about women and men's differentiation in the blocking of the DHT. And that is definitely something we'll take up in another episode because it really goes quite deep. And, as the old saying goes, the more we learn, the more we don't know, right? Uh,
Absolutely.
Oh my goodness. And so much changed with the pandemic and, bad, but in our world with JAK inhibitors and so many other knowledgeable factors of learning about these synthetic DHT blockers and what we can do now to support the DHT blocking for men and women with natural saw palmetto Serenoa. So thank you. That was awesome. I love it. Well, now the other two that I have on my list are not maybe quite as popular, but the first, which I really do like, and for all the same reasons I'm sure that you will, I can't wait to hear how you're feeling about red ginseng. So tell me about that and how you like to use that and discuss that to your patients and talk about them with utilizing a natural treatment.
So ginseng has been used for centuries. We know that it's very good for us. We know that it's stimulating, yet it works in harmony with everything else we have going on in our bodies. And so in terms of people that want to keep things very clean and not have things that can cause other issues, red ginseng ticks all the boxes. And for people, again, where diet isn't quite so good or absorption isn't quite so good, using it as a supplement, it's got proven benefits. As with anything, more research is always needed. But there is evidence there about ginseng being a very good supplement to use.
Oh, yes. And you're, spot on again with there are many studies actually in the US and I'm sure across the world that talk about the benefits of ginseng from a holistic perspective of reducing the inflammation in our bodies as well as our scalps, right? And making sure that we're reducing that oxidative stress on the scalp is also extremely important. And that's one of ginseng's claim to fame. So excellent. Okay, so our last one today is pumpkin seed oil. And so a pumpkin seed oil also has clinical evidence. And here we are back to our buddies, right? DHT and alpha 5. So, and they're shaking hands again. So maybe pumpkin seed's going to show up and help them kind of break off that bond.
So pumpkin seeds, full stop, even if we don't talk about the oil. I talk to my patients about the importance of protein, and many of us don't eat enough protein, and pumpkin seeds are brilliant. A teaspoon of pumpkin seeds gives you 5 grams of protein, but it also gives you all the benefits that pumpkin seeds have. And exactly as you've said, not only are they a protein, they're an anti-inflammatory. They have shown promising evidence of blocking DHT and being supportive in the management of androgenetic alopecias, male-female pattern hair loss. As always, more research is needed, but the early studies are showing that using them alongside more traditional treatments, there's a definite benefit and increase in response to treatments.
Well, yes. And the combination approach, right? Similar to your Trico Extra supplementation, is really bringing a lot of these supplements together so that when our patients and clients, male or female, young or aging, have hormonal, have thyroid, have loss of hair, we find that we're actually seeing a much better opportunity for the holistic self to be in better shape, which then of course helps with the look, the feel of our hair, the sheen, and then the density and certainly the hair count. So it's just amazing how this all works together.
I'm forever amazed at how regenerative the hair is, but how easily it is affected by everyday things. Inflammation and stress being the two antagonists that are the worst. And I love listening to a dermatologist called Dr. Jeff Donovan. And I base my clinical practice on very much his advice is that we layer things. So we use the most effective first. And if on review we think we can do better, we add in. I'm very much against throwing the kitchen sink at everything, because then you don't know what is best for your individual patient. And I'm very much about giving them what they need, not everything, because you only need what you need. And so that's where the treatments are lovely, because you can layer them. You can use them in isolation. You can use them with other more mainstream treatments, and you can see the difference. And that's what I love. And exactly as you say, we don't know what we don't know till we start reading about it and find out more. And that's happening all the time in the world of hair.
Well, oh, yes. I mean, I'm so excited to be in trichology at this point in time. And as yourself, we both have over 20 years experience here and actively involved in Dr. Jeff Donovan's fellowship. It's just a whirlwind of information. And so we're excited to be able to share this from natural treatments as well as lots of other things that our audience will be able to hear in some time. So all is well here in the US. I hope the same there in the UK. And we will talk to you very soon. Thank you for all your information today.
Thank you for having me, Kimberly. It's a lovely partnership, and I'm so looking forward to growing and working together.
Yes, ma'am. Take care. Bye-bye.
And you too. See you soon. Bye.